Here are two examples of normal ovaries from the last lecture. In the left image, the ovary is round and solid, shown at the red arrow. The other structure is the uterus. As we learned in a previous lecture, the position of the ovary can vary, but it is usually near the uterus. The ovary in the right image has a more common appearance. It is oval and contains small cystic structures called follicles. In this image, the arrow points to an adnexal mass. Do you see it? Please pause the video now to study the image more closely and try to identify the borders of this adnexal mass. Here we have outlined the mass. It is irregular in appearance and the borders are hard to see. It has no follicles or corpus luteum. Here is another adnexal mass. Please pause the video now to ask a volunteer to outline the shape of the adnexal mass. Here we have outlined the mass to make it more obvious. Notice how it does not look like a normal ovary. Notice the irregular shape and unclear borders. There are no follicles or corpus luteum. Sometimes you might identify a gestational sac outside of the uterus. This is called an extrauterine sac. It is an uncommon but possible sign of an ectopic pregnancy. Usually, you will see an echogenic ring outside the uterus that is distinct from the ovary. You may also see a yolk sac or fetus in the ectopic pregnancy. The fetus itself may have visible heart motion or not. This image has an example of a gestational sac that is outside the uterus. Please pause the video now to ask a volunteer to identify the ectopic pregnancy and the ovary in this image. Here we have labeled the ectopic pregnancy that contains both the gestational sac and the echogenic tissue that surrounds the gestational sac. Notice that there is no surrounding uterus around the ectopic pregnancy. A fetal pole is visible inside the gestational sac. The ovary contains several follicles and is nearby the ectopic pregnancy. Here we have labeled with crosses the complex fluid that surrounds the ectopic pregnancy and the ovary. This is blood clot and suggests that the ectopic pregnancy has begun to rupture. Here is another example. Can you see the gestational sac and the ovary in these images? Please ask a volunteer to point out these structures and pause the video. Here we have outlined the ectopic pregnancy, ovary, and echogenic fluid around the ectopic and ovary, noted with crosses. This is another example of an extrauterine gestational sac. Here we have outlined it to make it more obvious. A fetal pole is visible in the gestational sac. Not all fluid in the endometrium will look anechoic. Most often, the endometrium simply looks thicker and echogenic, with possibly some small anechoic fluid component. The anechoic component may be mistaken as a gestational sac, which is called a pseudogestational sac. A real gestational sac will have a fetus or yolk sac, which you need to see to confirm an intrauterine pregnancy. If you do not see a gestational sac, but see echogenic or a large amount of free fluid, or an empty uterus with an adnexal mass, refer the patient urgently to the referral hospital. This may be due to an ectopic pregnancy, which is an emergency. Let's review the complete guidelines for first trimester pain and bleeding. When we do an ultrasound, we should ask ourselves 3 main questions. Do I see a gestational sac? Do I see anything else? What is the appropriate follow-up? If a patient complains of pain and/or bleeding, and you see free fluid or an adnexal mass, refer immediately to the hospital. These patients are at high risk for an ectopic pregnancy. The risk is especially high if there is a large amount of free fluid or if the fluid is echogenic. If you see a gestational sac and the mean sac diameter is more than 20 millimeters without a yolk sac, or more than 25 millimeters without a fetus, or the fetus has no heartbeat, refer urgently to the hospital. These cases may represent a mix of ectopic pregnancy, blighted ovum, and fetal demise. If you see a gestational sac that is less than 20 millimeters without a yolk sac, repeat the ultrasound in 2 weeks. Let's review the key points. Ectopic pregnancies occur in 1 to 2% of all pregnancies. Ectopics can cause bleeding, which can be life-threatening. An intrauterine pregnancy on ultrasound makes an ectopic very unlikely. Any patient with suspicion for an ectopic should be immediately referred to the hospital. Questions for review. What is the most common location of an ectopic pregnancy? The answer is the fallopian tube. What symptoms will the patient have? What can you feel on clinical exam? The patient will often have pelvic pain and bleeding. You may feel an adnexal mass on exam. What should you do with these patients? The answer is an ultrasound. If the ultrasound suggests an ectopic pregnancy, send her to the referral hospital immediately. What are common signs of ectopic pregnancy on ultrasound? Common signs include echogenic free fluid and a complex adnexal mass. Which ultrasound findings in early pregnancy would prompt you to ask a patient to return in 2 weeks for a follow-up scan? The answer is seeing a gestational sac less than 20 millimeters without a yolk sac. If there is any suspicion for an ectopic pregnancy, refer emergently to the hospital. Thank you for your attention and interest in learning pregnancy ultrasound.